Headache. Muscle contraction, tension and vascular changes cause about 90% of headaches. Occasionally, though, a headache can indicate an underlying intracranial, systemic or psychological disorder. Throbbing vascular headaches, migraine headaches, affect up to 10% of Americans. Migraines usually begin in childhood or adolescence and tend to recur throughout adulthood. Migraine headaches often run in families and are, more common in women than in men. So, what causes it? Most chronic headaches actually result from muscle tension caused by emotional stress or fatigue, menstruation or environmental stimuli like noise, crowds or bright lights. Other possible causes include glaucoma, inflammation of the eyes or of the nasal or paranasal sinus mucosa, and diseases of the scalp, teeth, extracranial arteries or the external or middle ear. Vasodilators like nitrates, alcohol or histamine can also be factors. Systemic disease, hypertension, head trauma or tumor, and even intracranial bleeding, abscess or aneurysm may be involved as well. Okay, so let's talk about the pathophysiology of headaches. Headache pain may actually come from a bunch of different pain-sensitive structures like the skin, scalp, muscles, arteries and veins. It can also originate from cranial nerves 5, 7, 9 and 10, or from cervical nerves 1, 2 and 3. When we look at what's happening inside the skull, things like traction or displacement of arteries, venous sinuses or venous tributaries can play a role. Inflammation or direct pressure on the cranial nerves that have afferent pain fibers can also contribute to headache pain. The cause of migraine headaches isn't really known, but researchers do associate the disorder with constriction and dilation of both intracranial and extracranial arteries. So what should you look for? Well, the signs and symptoms really depend on the type or cause of the headache. This could be a migraine headache, muscle contraction and traction inflammatory vascular headache, intracranial bleeding, or even a tumor. When it comes to migraine headaches specifically, you might notice unilateral pulsating pain, which tends to become more generalized as time goes on, and it can last up to 2 days. There may also be a premonitory aura, like scintillating scotoma, hemianopsia, unilateral paresthesia, or a speech disorder. Other symptoms can include irritability, anorexia, nausea, vomiting, and photophobia. Muscle contraction and traction inflammatory vascular headaches can present in a few different ways. Sometimes there's a dull, persistent ache, while other times the pain is severe and just unrelenting. You might notice tender spots on your head or neck, or even a feeling of tightness around the head that has this characteristic hatband distribution. Intracranial bleeding, on the other hand, can show up with neurologic deficits like paresthesia or muscle weakness, and interestingly, the pain may not be relieved by opioids. When it comes to tumors, pain is often most severe when the patient wakes up. So, what tests can actually tell you what's going on? Well, skull X-rays, including those of the cervical spine and sinus, EEG, MRI and CT scans, which are usually performed before a lumbar puncture to rule out increased intracranial pressure, are all useful. PET scans and lumbar punctures might also help determine if there's a secondary or pathologic cause behind the headache. Treatment really depends on the type of headache. Analgesics, ranging from aspirin to codeine or meperidine, also known as Demerol, may provide symptomatic relief. Sometimes a tranquilizer like diazepam or Valium can help during acute attacks. Identifying and eliminating the factors causing the headache, and possibly even psychotherapy, can be beneficial, especially for headaches triggered by emotional stress. For chronic tension headaches, muscle relaxants might be required. So let's take a quick coffee break and talk about migraine medications. For migraine headaches, approved medications include ergotamine, also known as ergomar galcanezumab GNLM, which goes by Emgality lasmiditan, or Revau and ubrogepant, also called Ubrelvy. Sumatriptan, or Imitrex, which binds with serotonin receptors, is also effective in aborting migraine headaches. These drugs and others such as metoclopramide or Reglan or naproxen, known as naproxen, work best when you take them early in the course of an attack. Sometimes antiemetics like ondansetron or Zofran might be prescribed to help control nausea and vomiting. Now, drugs that can help prevent migraine headaches include propranolol, which is enderal calcium channel blockers like verapamil, or Calin and diltiazem, which is cardizem, as well as anti-seizure medications such as valproic acid or Depakote. So, what should you do? Unless the headache is caused by a serious underlying disorder, hospitalization is rarely required. In these rare cases, you really need to focus on treating the primary problem. Generally, a patient with migraine only needs to be hospitalized if nausea and vomiting are severe enough to cause dehydration and possible shock. Prevention, honestly, is worth its weight in gold. Evaluate the patient to determine how effective the prescribed analgesics, tranquilizers, or muscle relaxants are, and make sure to document your findings. It's important to help the patient understand the possible causes and remedies for their headaches. Prevention is often the best scenario when it comes to headache, especially migraine. Let's talk about the education edge. Some helpful headache teaching tips. Help the patient understand the reason for their headache so they can avoid exacerbating factors. Use their history and diagnosis as your guide. It's also key to assist the patient in figuring out if their headache is caused by particular triggers. Sometimes migraine headaches have chemical or hormonal triggers that really contribute to the migraine. Advise the patient to lie down in a dark, quiet room during an attack and to place ice packs on the forehead or a cold cloth over the eyes, or use other measures that are helpful for them. Instruct the patient to take prescribed medication at the onset of migraine symptoms, prevent dehydration by drinking plenty of fluids after nausea and vomiting subside, and of course, use other headache relief measures.
Thank you for watching. I do wish you a headache-free life. See you in the next video.